Caring for patients with a mental health diagnosis can be incredibly rewarding for healthcare providers and hospital teams, but it can also be emotionally draining and intellectually demanding. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer at AHA, and your host. The stress of accommodating unique patient and family needs, complex technologies, significant time pressures, and regulatory and organizational demands can take its toll on the well-being and resilience of providers and team members. Reducing provider burnout is vital to ensuring career satisfaction and maintaining the best patient care. The American Hospital Association supports the important goals of reducing burnout and improving workforce resiliency, defined as the capacity to handle difficulties, demands, and high pressure without becoming stressed. AHA offers strategies, tools, and resources that hospitals and health systems can use to foster and grow resilience and enhance well-being among their team members. In this podcast, Jordan Steiger, a performance improvement coach at the AHA Center for Health Innovation, discusses ways to achieve the goal of healthy patients and healthy care providers with Suzette Urbaschich, Director at Rogers InHealth, a part of the Rogers Behavioral Health System in Wisconsin.
Welcome to another session in AHA's ongoing series of podcasts where we learn how clinician and administrative leaders are navigating pressing healthcare issues. I'm Jordan Steiger, a performance improvement coach at the American Hospital Association Center for Health Innovation. And today we're talking with Suzette Urbaschich, the director of Rogers InHealth, which provides collaborative leadership through key initiatives to eliminate the stereotypes, prejudice, and discrimination that make up the stigma of mental illness. Rogers InHealth is a part of the Rogers Behavioral Health System that is based in Wisconsin, with additional care sites in 6 more states across the country. Suzette is on the front line working to improve the emotional health and resilience of their workforce. Part of this work has resulted in the creation of a compassion resilience toolkit informed by research and best practices related to resilience, positive psychology, compassion fatigue, organizational psychology, and mindfulness. Welcome, Suzette, and thanks so much for talking with me today.
Thanks, Jordan. It's great to be with you, and thank you for inviting me.
No problem. So first, I'd like to just start out. Tell me a little bit about yourself, your current role, and what drew you to the work in the area of workforce resilience.
So my background is in science and education with degrees from the University of Wisconsin, of course, and that includes a master's in administrative leadership and adult education. And I've really spent about the last 20 years in health and mental health education, primarily in the not-for-profit realm, and the last 8 years of which has been for Rogers InHealth. InHealth was created as the education and advocacy arm for Rogers Behavioral Health, as you cited. And Rogers is a private, not-for-profit provider of behavioral health services that's nationally recognized for specialized psychiatry and addiction services. So about 8+ years ago, InHealth was formed and charged to focus on stigma reduction, to reduce barriers, increase access to mental health care, and provide supports through development of best practices in stigma reduction. And as such, Rogers InHealth, we kind of sit in a really unique role. We're at this intersect of healthcare, education, and community. We learn through research, and then we develop, implement, and collaborate around programs and resources and training, all pretty much focused on reducing stigma and increasing inclusion for people with mental health challenges. And we also, by the way, serve as facilitative leadership for the WISE Coalition. WISE stands for Wisconsin Initiative for Stigma Elimination, and this is a statewide think tank and continuous learning collaborative community that we have helped to create. And so to answer your question about how we got to this compassion resilience work, we really came to it through the lens of stigma reduction. And this happened as we were meeting with focus and support groups, people with mental health challenges, to learn about what gets in their way of receiving the care and supports that they need. And what we learned was that some of their most stigmatizing experiences came from the very providers that they were working with. These caregivers who chose to enter these helping professions and yet sometimes find themselves not showing up as their best selves. And so we became curious about, well, what was behind these experiences? And we repeatedly found the connection between stigma and compassion fatigue surfaced regularly. So this resulted in our focus on compassion resilience, development of the compassion resilience toolkits, and now training facilitator teams to implement the toolkits in organizations with a growing focus also on building healthy culture. And at Rogers, this means adding provider well-being as a fourth pillar to the triple aim, understanding that without promoting the well-being and resilience of our staff, it becomes really increasingly difficult to positively impact those other pillars of client care, lowering costs, and improving outcomes.
Great. That's a really good overview. But could you describe a little bit more about what compassion resilience is and maybe how it's impacted your workforce?
Sure, I'd be happy to. So we use this somewhat informal definition of compassion resilience often in our work, and that is the power to return to a position of empathy, strength, and especially hope after the daily witnessing of the challenges that people and families face in our community and the realities of our workplace. That ability to be optimistic in what we know is always going to be an imperfect world. And understanding a little more about compassion fatigue helps us to understand compassion resilience. So we take time in the toolkits to describe compassion fatigue, and we do so by saying it's really a normal response to these abnormal situations we might find both in our workplace and or hearing about the experiences of those we serve. And for those in the healthcare field, it really involves identifying, preventing, and minimizing compassion fatigue, both within ourselves and within our cultures and systems. So kind of a fun thing, in the toolkit, we explore the stages of compassion fatigue, which we've actually adapted from the work of Eric Gentry. And I would invite the listeners to check out the CAT cycle of compassion fatigue in Section 3 of the toolkit. We characterize the various stages with faces of cats to demonstrate, for example, an early stage called the zealot cat, where we're hyper-committed, involved, ready to problem solve, make a difference, often an early career stage. There's the irritability cat, often characterized by anger and cynicism, sometimes diminished creativity, feelings of sadness, helplessness, hopelessness. And so we cycle through these different stages of cats, including the zombie cat, this sense of you can never do enough, maybe an inflated self of importance, sleeplessness, and so on. And we find that the cat faces seem to really resonate with people. But then there are, of course, the other indicators that most of us are very familiar with, things like absenteeism, turnover, and also those measures that we very often use in healthcare, employee engagement and patient care.
Great. And I noticed on your website that you broke this work into 3 separate areas. So I was wondering if you could tell me why you did that and what those areas are.
Well, yes, we've divided the compassion resilience work into 3 areas. And you might be referencing schools, health and human services, and parents and caregivers. Is that right?
Yes, definitely.
So I'm going to respond to that, and then I also have a little bit of a different response for you, too. So we actually started out by working with the Wisconsin Department of Public Instruction and taking a look at educator compassion fatigue. And so we got going on the schools toolkit from an educator standpoint, another helping profession. And, of course, we're in healthcare and work with a lot of health and human service partners in our work around stigma reduction. And so the toolkits being very similar in concepts, but changing out some of the content and context in which the concepts are applied. So, for example, the scenarios we use to walk through and help people learn the steps to compassionate action, the scenarios might be different between the schools setting and the health and human services setting. The third section, the parents and caregivers, really comes from a place very different than a professional setting. And that third toolkit we're currently in development of, it really comes more from the personal and family context. And so it'll be a little bit different style. It'll be more of, I don't know if you're familiar with circles as a vehicle, but that's going to be available hopefully by early this fall. I also wanted to mention, we take a look at compassion resilience in 3 different ways as well. That of individual, team, and organization. And the reason we mention this is because very often in the past, organizations have focused on wellness from an individual perspective. And this in and of itself isn't a bad approach, but we see it as a rather incomplete one. It's really difficult for an individual to grow their compassion resilience in a system or organization, a culture burdened by drivers of compassion fatigue. So we look at the stages at the individual level. We call this self-care. Also the team and organizational levels. The first third of the toolkit focuses on growing our understanding around the concepts of compassion fatigue, compassion resilience, and compassionate action. The middle third focuses on organizational culture and the system drivers of compassion fatigue, including those drivers we can control and those we can't. And then the last third of the toolkit focuses on multiple facets of self-care and goes well beyond those traditional ones of, eat more yogurt, exercise more, and sleep more strategies. Lastly, I would just mention that the toolkit really looks at the important role of leadership. We know that one strong predictor of compassion fatigue is the lack of clarity about the vision and the mission of the organization and each employee's part in that. And this becomes a really important role for leadership and a really key to job and compassion satisfaction. And there are lots of assessments in the toolkit for these 3 levels, including, for example, something called the ProQual, which is the Professional Quality of Life Scale. These are available to help provide information about compassion satisfaction, burnout, and secondary traumatic stress. So I know that's way more than what you were asking for, but there are lots of ways to look at the toolkit, not only from a sector perspective, but from the hierarchy in an organization.
That's great, and I think that gives other hospital teams listening in today a really good insight into what they could adopt into their own hospitals. So to follow up on that, I'm sure people would be wondering who coordinates and funds this resilience work?
Sure. So our initial work to develop and pilot the toolkit, I mentioned earlier, was done in partnership with resources from the Wisconsin Department of Public Instruction and also the Wisconsin Department of Health Services. So we were able to create, develop, pilot, and really tweak and finalize the toolkits with that support. And so now we're conducting facilitator trainings around the state for various teams in healthcare organizations, schools, community, corporate partners, and so on. So within Rogers, it really is being coordinated through our department in health. And one of the things that we've learned, a really important lesson, is that the toolkit needs to be implemented internally to be sustained, not brought in by an outside consultant who, puts another program on your shelf. So the training is really designed for internal teams to lead and implement within their own work groups. And another lesson that we've learned is that the work falls short if the team and organizational level issues, such as things like work boundaries, expectations, if those aren't addressed and the organization is not prepared to respond. So at Rogers, we knew the compassion resilience work would resonate with our frontline staff. And that's the place where the distress and pain is most evident. And we've been asked over the last number of years to do bits and pieces of this work with frontline work teams, including even our dietary team. What we weren't sure was how our leadership would respond. And we really were not looking for a rubber stamp from our leadership to implement yet another initiative, but really we wanted their direct engagement from the lessons we had learned. So we engaged our executive team to get their buy-in, and 20 senior execs went through 12 hours of compassion resilience training together as their own team before anyone else in the organization has. So one of the key outcomes of that experience was for one of our InHealth directors being asked and tasked to now look at and assist building a healthy and resilient culture organization-wide, and align all of our initiatives, our language around compassion resilience. And this work now supports one of Rogers' 5 strategic priorities, which is healthy culture. So we've really embraced compassion resilience as part of who we need to be.
That's great, and it does sound like you have buy-in from all levels of your organization, but how do you handle any challenges or pushback?
Well, that's really a great question, and actually, part of the toolkit process is to help identify the challenges to compassion resilience at those different levels, at the individual, the team, and the organizational or system level. We go into this work understanding that compassion fatigue exists. And then the challenge is to identify it and have folks identify that for us. What does it look like? Ask what priority has it been given and do we need to give it? And then what is our role in addressing compassion fatigue and building compassion resilience at the individual, team, and organization or system levels? So for our InHealth team, the challenge really was to take a look at the research around stigma reduction, quality improvement, and the connection, not surprisingly, to joy and work, and to consider what does all of that data and our data tell us. For our senior leaders, the challenge was to really take an honest look at their own compassion fatigue, and that as well as across the organization, and to understand that this is not a program, it's a culture change. And out of that came some questions and challenges that we will be in the process of exploring together at Rogers. And so some of these things include things like, how do we teach and coach the skills of compassionate boundary setting? Where is compassion resilience in our procedures and policies for such things as response to patient critical incidents, staff self-disclosure policies and training, staff personal crisis response? How do we hire, train, coach, measure, acknowledge, and incentivize for compassion? And then the big one for us is how do we align and integrate compassion resilience with all of our other initiatives? And we have a lot of them, including our rapid improvement system, emotional intelligence, employee and talent development, and so on. It seems like a daunting task, but the challenge is to take it in small steps at those 3 levels, individual, team, and organization.
Great. And I love that you said that this is more about culture change than just some other initiative. So I think that's a great lesson for hospitals to take away that are listening today. So when we're thinking about burnout, we know that this is a problem that hospitals across the country are facing, no matter what type of hospital they are. What aspects of the Compassion Resilience Toolkit do you think could serve as a model for other types of hospitals or other hospitals across the country that are experiencing problems with burnout?
I can share that the toolkit is really grounded in the work of the Schwartz Center for Compassionate Healthcare out of Boston, and also the Compass model of wellness from the Samaritan Family Wellness Center here in Wisconsin. It's really a compendium of resources and references that include all kinds of strategies and research-based work of folks like Kristen Neff, Brene Brown's Mindful Self-Compassion, the Institute for Healthcare Improvement's Joy in Work, Prochaska's Theory of Change, and numerous others. And I would say to you that since every staff member in an organization is also a member of other groups, families, community, faith groups, schools, whatever, the lessons and strategies learned are really applicable across sectors. The key really is what is the role of leadership in an organization, and to your point, creating the culture and the space to do this work. And so the toolkits really offer flexibility, a really broad framework to work within, really for any organization. And along with all the links to the resources, the supports, the videos, tools, and assessments, they're really adaptable to most any sector. And our WISE Coalition partners are doing just that. The toolkit's free and accessible online. We offer regular coaching call hours for consultation around implementation, and I've mentioned the facilitator team training we do. And we really love to hear about your listener efforts and applications of compassion resilience strategies and other uses of the toolkit. And we're getting those calls and those stories all the time, anywhere from library systems who want to do this work to corporate environments. And so some of the additional lessons learned that I would share with you. While an individual can certainly dabble in the toolkit and browse it and pick and choose things, especially out of the self-care section, that are really applicable, we have found that engaging a small team that includes 1 to 2 leaders as champions works especially well. When those teams come to a training, they get excited about it, they become the catalyst and take back tools and strategies to their organizations. And one of the keys is to look at and perhaps develop a culture contract, identify their system drivers of compassion fatigue, and really also look at issues of trust. We found that our employee engagement survey was a good place to start, to look at what teams were challenged with. And so those kinds of measures that other organizations use could also be a good data point place to start. And we've seen that a focus on compassion resilience that really connects staff back to those core values and sense of purpose, in this case, that drew them to healthcare in the first place, is key. But again, what's the purpose and core values and principles of any organization, and how is each and every employee connected to those? And a compassionate culture builds and strengthens skills to manage expectations, set professional, personal boundaries, build the really essential collegial relationships that, especially in healthcare, we're so dependent upon. And then practice real-time and ongoing self-care and self-compassion has to be part of the organization's culture. And finally, I would share with you that we recognize and emphasize this is not a quick fix. It takes about 12 to 24 months to really effectively move through the 12 sections of the toolkit and thus just begin to build a sustainable, compassionate, healthy culture. And yet, it's really so worth it.
That's great. And Suzette, thank you so much for joining us today and for sharing this great work with the field.
Thanks for having me, Jordan, and especially for recognizing the important role compassion resilience plays in all of our work. Thanks so much.
And also thank you to our listeners for tuning in today. If you want to learn more about the work that the AHA is doing to increase resilience and reduce burnout, please visit us at aha.org/physicians. To access the tools Suzette referenced today, Rogers InHealth encourages you to visit compassionresilienceToolkit.org. To learn more about compassionate healthcare approaches, we encourage you to explore resources from the Schwartz Center for Compassionate Healthcare.